Let me start with the lower prescription drug cost for seniors issue. Again, I went through some of what former President Donald Trump said. He said pharma companies were getting away with murder. He said that would change under his presidency, that he would create a fair and competitive bidding process, and prices would come way, way down. And colleagues, these are exact quotes from Donald Trump. And I'm quite certain, Ms. Secretary, when you came in, none of that had been actually accomplished. And I described that conversation I had with President Biden after the election, where he said he was going a very different route: Medicare drug price negotiation, stop the price gouging if they raise the prices over inflation, cap out-of-pocket costs for seniors. He took on big pharma and won. Not just talk, delivery. So, Ms. Secretary, one that I was very involved in, stopping this price gouging. Is it correct that some seniors are now saving $618 per dose on a drug that they get in their doctor's office?
Senator, that's correct. And it's going to grow even more in terms of savings, because as we move through the years, many of the provisions that you all helped pass are kicking in. So today, a senior won't have to worry about these enormous costs if they're on a drug medication, because there's a limit now on what they will pay. They're capped spending, so it might be about $3,500 this year, but next year the limit on expenditures out of pocket for a senior, $2,000.
Now, for the first time, in addition to the price gouging penalty and the out-of-pocket costs and these priorities that I mentioned, for the first time, Medicare is negotiating drug prices. And on this one, as I say, we beat pharma and took away their holy grail, which is trying to prohibit negotiation. I'd like to hear more about the 10 high-cost drugs that you're negotiating. How many people with Medicare take the drugs that you're negotiating this year? And I don't believe I've seen an aggregate number of on this. That I think the American people would like to know how many people with Medicare take these drugs that you're fighting to lower the prices on. What's the number?
So, Chairman, let me work down. So we know there are 66 million Americans who receive health care through Medicare. Not all of them take the 10 drugs that we're negotiating, but for many, they are life-saving and they need them. Suffice to say that in 2022, the cost of just these 10 drugs, just for Medicare, the 66 million, not the 330 million Americans, just the 66 million Americans on Medicare, the cost of those 10 drugs in 2022 alone was $46 billion. Out of pocket from those very seniors who were using those drugs, about $3.5 billion. And so it is big money for just those 10 drugs. And the next year, when we get to negotiate for 50 more drugs, we'll get to save Americans even more.
And what's the ballpark number, Ms. Secretary, in terms of how many people with Medicare are taking these drugs?
I couldn't give you the specifics on all the 10. I don't have that before me, or any one of the particular ones, but they're very well-known drugs. And for seniors, they treat principally issues like cancer, heart disease, kidney failure. It's the kind of chronic disease that we know quite a bit about. I could try to get you specific numbers.
Why don't you get us that for the record? But you're saying that the amount of money involved in this area, I thought I heard you say $46 billion.
$46 billion in 1 year for 10 drugs. Okay. Just for Medicare.
In 1 year, okay. Let's talk about this cybersecurity breach, which is, so serious. And I'm of the view that it also relates to the fact that these facilities are getting bigger and bigger. And then I think they become really a systemic kind of risk. And we've got to get on top of this. For a long time, these private companies have been allowed to set their own standards, and it doesn't seem very surprising that neither United Health Group nor federal agencies were prepared for the attack on Change Healthcare and its fallout. And my view is that the healthcare sector is a prime target for criminals and foreign adversaries. And as I say, as these companies have become so large, it is creating a systemic cybersecurity risk. Today, there are no federal mandatory technical cybersecurity standards for the healthcare industry, even though people have been talking about this for ages. Something like, 2 decades. I want to make it clear that has got to change now. Now, I understand that in your budget, you're going to increase penalties for compliance violations and make the first actual concrete proposal to require real mandatory cybersecurity standards for hospitals. Mandatory standards are a great first step, but we've got to do more. And the next step has got to be the fines and accountability for negligent CEOs, for example, which will enable HHS to better protect patients and our national security. Will you work with me, Mr. Secretary, to start holding these executives who are not doing their job in line with the kind of safety standards the American people have a right to expect on cyber? Will you work with me so we start holding the negligent CEOs accountable?
Mr. Chairman, we look forward to working with you and every member on this dais on these issues.
All right. Senator Crapo.
Thank you, Mr.